everyone. I'm Chris Williams with Emeritus Health, home of Balance University. And again today I'm with our medical director, Mrs. Jill Anderson. So very excited to have her on board for sure. So today I wanted to talk a little bit about fall and fall prevention. And one of the instances that I see a lot of, and I'm sure you do too, is folks are embarrassed when they fall. We all are. It doesn't matter what age you are, you know. And so I had a particular client that was living in a facility. If you reached a certain level of falls, they would move you to a different portion of this facility, or a different part.
Right.
And the deal was that this particular individual probably should have started working on their balance a few years prior, before the actual fall started happening. And she became like a repeat offender with the falls. And so that's dangerous because, one, we can do something about that. You do not have to get into this cycle of falling. We can break that. And two, there's dangers there. There could be injuries that you don't identify right away that could build up and cause a problem or an issue that maybe we can't solve.
Right.
So, Jill, does this sound like a situation that's familiar to you in your practice?
Yeah, it can happen. I mean, people do not always report their falls, and you know, like you said, there's a sense of embarrassment, or you know, the sense of losing control even.
Yeah.
You know, they don't want to lose control, or the idea of having to use an assistive device. A lot of people say, no, I want to be independent, and I don't want to rely on an assisted device, whether it be a cane or a walker or so forth. So they tend to hide those types of even minor falls in the house, whether it be just walking around their own home, or whether it be trying to be out and about and active. So that becomes an issue where patients actually tend to not be very forthcoming to their healthcare providers, and we may not always know what's going on, and that's potentially dangerous.
They don't want to lose their independence, and that's the biggest thing I see. In fact, one of the exercises we do in Balance University is to help increase your mobility in the cervical spine, in the cervical area. And the reason for that is you need to be able to rotate and see in the peripheral, but also when you drive.
Absolutely.
You need to be able to see in your peripheral, because when you start, I think the stigma is that when you start using walk, you start losing your balance, you're starting to see your independence slip away, and that really scares a lot of people. So I think there's some statistics out there too that talks about the falls and repeat offenders.
Yeah, one of the things that the CDC documented was that almost 50% of the time individuals do not report a fall to their healthcare provider. So 50% is a very, very high amount. But the other part of this that's so important to remember is that once you have one fall, your chances of falling a second time doubles. And that's huge. That's extremely significant. So when you think about that, and you think about the potential injury that can happen as a result of a fall, that hadn't been addressed initially, that can be very problematic, and a long-term injury potentially to somebody, which is where our balance becomes so important. And important to tell your healthcare provider if you've suffered a fall, so that we can intervene earlier, as opposed to waiting until another fall happens.
So here's another thing. If someone comes in your office, and you're seeing a patient and they say, listen, doc, I'm a level with you, I've fallen. Do you scold them?
Absolutely not. No, I'm very happy that they brought it to my attention.
Right, and you try to help them. And, and now with Balance University, you feel that there's an easy resource that they can access, either through book, through internet, through video. We have one of the most extensive Balance video libraries in the country. So I think the stigma is people are embarrassed because they think they're going to get in trouble. And that's not the case at all.
That's not the case. And certainly from a medical standpoint, my job is to make sure there isn't any medical reason why there's falling. So once we've ruled that out and we've decided this is purely a balance issue, because again, we don't want to miss something that may be going on medically, and that's important for you to bring it to our attention as well. But once we've ruled out any medical issue, certainly balance tends to be the #1 reason why people fall. And so if we can bring that to the forefront sooner, we can address it sooner, and we can minimize the risks of falls in the future.
That's it. And you can keep driving, which is great here in Naples, Florida. We love having them all on the road. All right. Jill, thank you very much.
Thanks, Chris.
All right. See you guys.